Well, I believe that the profession has made a great progress towards oral health and oral health prevention. And this has been due not only to scientific advances and gathering of new evidence, but also due to the impact of oral health products industry. Because this linkage between the appropriate use of oral health products and oral health prevention, I think, has been fundamental to raise public awareness on mass media and on making the real impact on people, prompting to behave differently in terms of oral health prevention. Where have we fallen short? Probably to diminish the prevalence of the most severe periodontal diseases. I think the incidence of chronic gingivitis and the early forms of periodontitis has diminished over the years, mainly in developed countries, but this has not been the case with severe periodontitis. And probably the complexity of this disease, with so many factors involved in the etiopathogenesis, has made us less predictable on how to prevent it and how to treat it. Well, this is clearly the case with severe periodontitis, that after about 50 years, the rates of prevalence all over the world, including developing countries and developed countries, is very similar, about 10% of adults. And this, of course, reflects that we have not been able to really identify, mainly in terms of diagnostics, which are the people who are really susceptible and what are the biomarkers associated with the initiation of tissue destruction in these periodontitis cases. We normally diagnose too late, and we normally evaluate patients that have lost a great deal of their periodontal support. In the area of personalized medicine, we have not been able to personalize, really, these patients with severe periodontitis. We don't have the appropriate diagnostic tools, and probably we do not have appropriate personalized interventions to treat individually to patients affected by these severe forms of periodontitis. Well, we in periodontology developed the first clinical practice guidelines basically 5 years ago with the clinical practice guideline on the treatment of periodontitis. And this has been a huge step forward to help not only clinicians, but also patients to understand which interventions are solidly based on evidence, and also which interventions have the real cost-benefit positive ratio to be recommended and used extensively by oral health profession. From this first clinical practice guideline, others have been developed for the treatment of stage 4 periodontitis, for the treatment of peri-implant diseases, and now very recently for the treatment of gingival diseases. I believe that these are essential tools, very widespread used in medicine, recently used in dentistry, but I think they will be a real game changer in how the profession approaches the prevention and treatment of these diseases, mainly periodontal diseases. I think it is fundamental to make the population understand the importance of oral health for general well-being and for a healthy status. We already discussed with WHO many years ago the convenience to include oral hygiene as one of the key healthy lifestyles, similarly as making exercise, reducing weight, eating appropriate diets. Unfortunately, WHO did not include oral hygiene in these healthy lifestyles. And I strongly believe that this is fundamental because people understand that these healthy lifestyles will help them to live longer and to have a much higher quality of life. And so they are prompted to change their behavior towards that end. This is similarly important with oral health. We understand today the implications of oral diseases in general well-being, even in living longer, because there is a very direct association between severe periodontitis and death. And therefore, I think we have failed short to making the population understand the importance of oral health. And I believe that if we are successful in these aspects, I think we can change a lot of people's behavior towards improved oral hygiene and towards improved oral health. On March 19th, 2026, global experts will join in Madrid, gathered by CEPA and Listerine, to discuss the global crisis of periodontal diseases prevention. I think this event will be very important, I would say critical, to understand what can we do in the future to improve the prevention of periodontal diseases and therefore to improve systemic health of the population. Please join us on March 19th for this Global Summit on Oral and Periodontal Disease Prevention.